How does hyoid suspension surgery affect the epiglottis and airway? Have you ever wondered how a small bone in your neck can impact your sleep? Let's talk about hyoid suspension surgery and its effects on the epiglottis and airway. This procedure is often used to treat obstructive sleep apnea, a condition where breathing is interrupted during sleep. The hyoid bone is a horseshoe-shaped structure located in the neck. It plays a key role in keeping the airway open while you sleep. This bone connects to the epiglottis through a ligament called the hyoepiglottic ligament. When you sleep, your muscles relax, and the hyoid bone can shift backward. This movement can cause the epiglottis to fall into the throat, blocking the airway and leading to sleep apnea episodes. Hyoid suspension surgery aims to prevent this issue. During the procedure, the surgeon pulls the hyoid bone forward and secures it in place with stitches. This can be done by attaching the hyoid bone to either the thyroid cartilage, which is also known as the Adam's apple, or the mandible, which is the lower jaw. Now, how does this affect the epiglottis? The impact is mostly indirect. By stabilizing the hyoid bone, the surgery helps keep the epiglottis in a position that allows the airway to remain more open during sleep. This reduces the chances of the epiglottis falling into the airway and causing obstruction. As for the airway itself, hyoid suspension surgery is designed to improve its patency. This means it helps keep the airway open and prevents it from collapsing while you sleep. By maintaining the forward position of the hyoid bone, the surgery helps ensure that the structures attached to the epiglottis do not obstruct the airway. For many patients with obstructive sleep apnea, especially those who experience blockage at the tongue base level, hyoid suspension can be a beneficial option. It is generally considered a safe procedure with a low rate of complications. One of the advantages is that it does not directly affect the soft tissues of the tongue, which can lead to a less painful recovery compared to other surgical options. However, it is important to note that hyoid suspension may not work for everyone. It might not be effective for patients with more severe airway obstruction in the hypopharyngeal region. Always consult with a healthcare professional to determine if this surgery is the right choice for your specific situation. In summary, hyoid suspension surgery can positively influence the position of the hyoid bone, which in turn helps keep the epiglottis and airway open during sleep. This can lead to improved breathing and a better night's rest for those suffering from obstructive sleep apnea.